Hi, this is Dr. Walker. I'm here with Dan today, and we had another comment. We wanted to answer that question. The question is, a dentist friend of mine has just hired a marketing consultant. What are your thoughts? Well, Dan, I know you've spent a lot of time with your years as a trainer in different offices and different techniques and marketing strategies, so I thought this might be a great question for you to answer.
Thanks, Dr. Dean. Okay, so obviously you have two different options here. You can hire an agency where you can pay an average of $1,500 to $2,000 a month, and they can do all of your social postings and YouTube videos or whatever, and get out and actually meet with the offices and become familiar with the people who work at the front and create some type of bond. The other option that I prefer is actually having an in-house marketing person come in. And the reason that I prefer that is because then it becomes personalized. The other option that I first gave you was somewhat generic. And yes, they can customize it somewhat, but if somebody's in your practice and doing just your practice, outreach, then it can become a lot more personalized. So they can do all your Facebook posts. They can do all of your, your different posts on maybe on TikTok, and which is, something that is just blowing up right now. Not too very many people like. The problem here is based on cost and based on training. So is it going to cost you a little more? Yes. But is your return on investment going to be better? Much more. Much more. I went to a conference a few years ago in Texas, and one of the doctors there who actually had an in-house marketing person said that if he would have done this 5 years before, he could retire 10 years earlier. And so that hit me. I mean, that was incredible. And it made a lot of sense. If you spent the money in marketing, your business is going to grow, you're going to get busier, and that way there, you can have obviously more income coming in, which in turn allows you to either hire an associate and so you can work less, or retire earlier. So with that in mind, then I think hiring an in-house, even on a part-time basis on 20, 25 hours a week, allows you to be able to personalize what you want, and then you can have them right there. The other thing that I think that CDI is going to get involved in is creating an online course to actually be able to train someone to become a marketing person within a dental practice. So we are looking into that right now and looking at different avenues on how to approach that. So I hope that answers your question right there.
I think so. Maybe I could just summarize to make sure. So see maybe three main avenues. The first would be an outside company. The downside with that is maybe a little more generic, maybe not as much customized to you. The second would be hiring someone maybe even part-time, depending on the size of your practice and your budget, to come in and specifically do marketing. Or the third might be a current employee you have that you might train to become your marketing specialist. Is that correct? That is correct. Okay, perfect. Well, thank you, Dan. Thank you guys for joining us again today. Be sure to subscribe and like us. And as always, send us your comments, and hopefully we can talk about your question on our next video.